Well, first of all, I want to say welcome to everyone. This is Dr. Rita's session where she talks about CBD and the benefits of CBD. What is CBD? Benefits of CBD. And we're so glad to have each of you here. This is, it's an honor. I don't know about you, Dr. Betty, but I think it's an honor to be able to stand in. This is my first, or as Dr. Joy would say, this is my solo presentation. So please be merciful to me.
Congratulations.
Thank you. We want to be able, first of all, before I think we go any further, I want to acknowledge that Dr. Rita is with us, and but not able to be on this particular presentation tonight because she is home with her family. One of her children is ill, and we want to be able to lift her up and before the Lord, and we're just calling for complete healing, a rapid, swift healing. And if you're a praying person, pray. If you are an individual that can just think kind thoughts, think kind and positive thoughts, because thoughts are things and they work. So we just want to be really in prayer for that healing. So without going too much off course, I want to get into what is CBD. We want to talk tonight about what is CBD and the benefits of CBD. And Dr. Joy, you're welcome to, I'm sorry, Dr. Joy. Dr. Joy will be joining us. She got off work late, but she said she hopes to be joining us, and we're glad to be a part of it. Those of you that don't know Dr. Rita McGuire, she is the Chief Medical Officer and one of the 4 pillars of Wakanna. And we're so excited because we're a part of her team that she has put together, and the medical board that she has developed. And we're really glad to be a part of it. They consist of doctors and specialists, nurses, chiropractors, psychologists, psychiatrists, and even Dr. Bettie Smith. I'll let you introduce yourself in just a second. But I am Dr. Lorraine Sylvester. My doctorate happens to be in theology. But my career is, I am also a licensed, state licensed therapist. And I work with people that have anxieties and mental health disorders. And CBD has been very, very beneficial in that area for me. We'll talk about that a little later. But I want Dr. Bettie Smith to go ahead and introduce herself. And she and I, along with any of the other team that'll be joining us, we'll all pitch in and we'll talk about it. And whoever's out there this evening, if you have a testimony, we want to hear from you too. But right now, Dr. Bettie, take it away.
Good evening. So I am Dr. Bettie Guy-Smith. I'm a registered nurse for over a long, long time, well over 40 years. And I am also a doctor of naturopathy licensed in the state of Illinois. And in that capacity, I offer drug-free, holistic therapy utilizing herbs and oils and food and manipulation, physical manipulation, similar to chiropractic. And I've been doing this for well over 30 years. I am a Ruby with Wakanna, and I am just so honored, like Dr. Sylvester, to be able to just dialogue today about CBD, our great products that we have are organic and holistic products, and also to just help in educating you about things like the endocannabinoid system and all of that. So let's go.
Let's do it. Well, first of all, I'm going to talk about what is CBD, and I can talk about some of the benefits, but I'm going to ask Dr. Betty to also jump in and help us with that. And wherever else, Dr. Betty, you can be informational, feel free to do so. But what is CBD? Well, CBD, first of all, stands for cannabidiol. And it's the second most common cannabinoid, and it's found in different strains of the cannabis plant. And it's the most common cannabinoid found in the hemp plant. It has no mind-altering, and that's really important, no mind-altering effects like THC, which is most frequently referenced as in the cannabidiol. But it does share some medicinal benefits with THC, and a whole lot more. As a matter of fact, CBD or cannabidiol can be broadly used in conjunction with other forms of treatment to prevent various diseases like diabetes, lupus, and of course, the mental health disorders that I work with. And that's just to name a few of them. So the cannabis plant has two species. Okay, you've got the marijuana plant and you've got the hemp plant. And when you look at the marijuana plant, now that's the one that has the high, the THC, or the delta-9 tetrahydrocannabinol, cannabidiol. And that's what gets you high, that delta-9. And it's high in THC, low in CBD, or cannabidiol. Takes me a minute, but I can say it. And the cannabidiol is what gives you your health benefits. Now, when you're talking about the hemp plant, now that's the other species. And that's high in CBD. As a matter of fact, there's only 0.3% or less of THC, or the delta-9, in the hemp plant. And it's low in THC, so the medicinal benefits or the health benefits are very, very high. And so that's why we love, at least I do, I love the CBD, because in each of our systems, we have what's called the ECD, it's called the endocannabinoid system. And that system has receptors, and those receptors in our system help us to broadly assist with whatever diseases are there. We're trying to get to homeostasis, and where we're in balance in our system. And sometimes our systems are off balance and we have different diseases that tend to come. But when we look at the CBD, it has lots and lots of benefits. It's antibacterial, it inhibits the cancer cell growth, it has neuroprotectants, promotes bone growth, it reduces seizures and convulsions, it reduces blood sugar levels, really good in the diabetes area. Again, it broadly undergirds whatever you're going through in terms of a disease. It relieves pain, it relieves anxiety, And it slows bacterial growth. It suppresses the muscle spasms and tranquilizers. And it is an overall support system when we look at our endocannabinoid system. I am going to stop with my piece because I want Sister Dr. Betty to assist here. And I just saw Dr. Joy trying to come on board, and I hope she hurries up and comes on board because Dr. Joy does a wonderful presentation, probably much more than I do, but certainly I can speak volumes about the CBD effects and the benefits of it. So Dr. Betty?
Yes. So I would like to just briefly cover the endocannabinoid system a little bit further.
Thank you.
So as Dr. Sylvester mentioned, you know, this is a system that was discovered some 25, almost 30 years ago. And what they discovered was that this system, the endocannabinoid system or the ECS system, is evident in all mammals. Now, the interesting thing about the endocannabinoid system, let's break it down. Endo means within. So within our bodies, we have a system that is literally looking for cannabinoids. And cannabinoids are the little substances that make up the cannabis plant or the leaf, whether it's hemp or marijuana. These cannabinoids have been identified in, oh my goodness, 100 plus thus far. And these cannabinoids, we ourselves make two types, anandamide and 2-AG. Now, anandamide is the most prolific, maybe the most, we have the most anandamide in our body. And it actually, if you were ever breastfed or get that runner's high, that is anandamide kicking in. So because of things such as pollution, echo pollution, poor diet, poor posture, mental, emotional stressors, and just the stress of life, the air that we breathe, all of these stressors cause our bodies to become deficient in the cannabinoids. And so the little that we are producing and that which is already being used up or eaten up by stress leaves little to nourish these receptor sites or feed these receptor sites that we have in our major organs and all over our bodies. So we need to supplement, I should say, the cannabinoids in our system so that the body has something to work with. And we do that through CBD oil. So when the CBD oil goes in, is taken into our system, it actually is disseminated throughout our body and acts like the key to the lock of the receptor sites. And when that union takes place, then the endocannabinoid system becomes totally functional, and its job is to regulate and modulate all of our other systems. When I say all, I mean the respiratory system, the cardiovascular system, the endocrine system, and on and on and on, all of our systems. It regulates and modulates them, and it allows them to become fully functional. And at that point, those systems can do what they are naturally meant to do: heal, regulate, and regenerate themselves. So when I first heard about the endocannabinoid system, I was shocked. And the reason is because, excuse me, at that moment, I realized why we have so many diseases that have pretty much are approaching or have surpassed epidemic proportions. Things like diabetes, heart disease, high blood pressure, what is that? Fibromyalgia is back running up the back door. Just a myriad of conditions that when I was in nursing school 50 years ago, we heard about them. We learned about these conditions, but we were hard pressed to ever see anybody with things like lupus and IBS, irritable bowel syndrome, Crohn's disease, and just and at that time, diabetes was known as a old people's disease. And look at here, we have children, we have young people with type 2 diabetes running rampant.
Exactly.
So I recognized when I learned about the endocannabinoid system that this deficiency is what is pretty much at the base or the helm or the foundation of many of these diseases and conditions that are just totally out of proportion now. So Dr. David Allen, who is a retired cardiologist and is a member of the Cannabis Advisory Council, states in his presentation that the endocannabinoid system, the discovery of the endocannabinoid system, is more important than the discovery of sterile technique. And that is the technique that prevents people from getting big time infections from in medical situations and the surgery and yada, yada, yada. But he said, yes, and I'm a surgeon and I'm saying this. So yeah, the endocannabinoid system is an awesome system, and we need to make sure that it is nourished and that it is kept in balance, because this is what will keep us in balance and in homeostasis and functioning at a higher level of wellness. Yeah, it blows me away when I really think about the fact that we have this balancing, check and balancing system within our own bodies, and that if we just manipulate it and give it what it needs, then it will work wonders for us. And that is why CBD seems to be so miraculous, like snake oil, because it's kind of good for everything except death, So I see Dr. Joy is here.
Yeah. And yes, I was so excited to see her, but I wanted to just kind of co-sign a little bit about the diabetes a little bit that you were talking about. Yes. Because CBD does interact with those receptors in the body, and it influences the hormones like the insulin and the melatonin and the cortisol in the body, because insulin, of course, is the hormone that is produced by the pancreas. And sometimes, diabetics need that. Mm-hmm. So that's something to look at. And we always say, and Dr. Rita always has that disclaimer out there that says, just remember, you need to talk with your physician, let your physician know exactly what's going on, and let them take the helm, the lead, but let them know that you are using or you're thinking about using the CBD, and let them direct you. Dr. Joy, if you are here, please unmute yourself. We see your picture, and we'd certainly like to hear from you at this time. Dr. Joy Smith.
Hello, Dr. Sylvester. Hi, Dr. Betty. How are you?
Hi, awesome.
Hello, hello, hello.
I'm just coming to the house from work, so excuse my lack of picture, but I'm trying to get in here. Did you have something specific that you wanted me to speak to?
Actually, I want you to speak to, we were talking about tonight, what is CBD? We're talking about the benefits of CBD, and I talked about the compounds in the hemp plant and that kind of thing. So anything you can add, Dr. Betty did a fantastic job, of course, talking about the endocannabinoid system and the support that CBD gives to it. And so wherever, and you're very knowledgeable in this area as a pharmacist, and all the other wonderful roles that you play at Wakanna. Congratulations again on your promotion in Wakanna. So anything you can add to us tonight would be great. And then, of course, anyone that has any questions of the three of us or any one of us, please go ahead and raise your hand or put your question in the chat box, and we'll be monitoring that and answering that as you send that question out there.
Got it. So following my oily role model, I don't know how much I'm going to be able to add, but I think what's most appropriate is for me to start with my story.
Okay.
The reason that I even got into botanicals, learning about natural methods of healing, some people may have heard this story, but my brother got diagnosed with cancer in 2014. And it was a very stressful time for all of us. I was getting married that year. I found out I was pregnant that year. You know, just a lot of things going on top of the fact that the only other experience that we had that was close to home with cancer was my mom passing in 97. So very stressful for us, but my brother had his time to have his experience, have his feelings, have his emotions, actually sit in them, because that's a healthy part of dealing with any type of scary situation, is actually sitting in those emotions. He decided that he wanted to take control of his own health and not only use traditional methods of healing, but also use alternative methods of healing, whether it was seeing a Reiki practitioner or doing detox foot soaks or changing his entire diet around by going to the Hippocrates Health Institute. So all of these different types of things he was doing that were not necessarily prescription drug based, that were not necessarily dictated by what his doctors were telling him to do. He was listening to those things. He was also trying to make sure how he can figure out how to heal his body on his own, and that he can do everything that he needed to do so that when he got to that traditional treatment, his body was a great playing field for whatever treatment needed to come. So he opened us up to that whole world. And my first journey took me to becoming a health coach. My next part of my journey took me to becoming an aromatherapist. And that whole learning about botanicals and how they can impact change in our bodies on even a cellular level was just fascinating to me. So I would always reach for an oil as opposed to reaching for something else, or always reach for an oil as opposed to trying to go get something for congestion. And then when Wakanna found me, it was just so in line with what I was already doing. We're all busy, all professionals, all have things to do, all family people. But when something aligns with what you're already doing and it works alongside your life, it makes it that much easier to pour yourself into it. So just the vast amount of knowledge that I've gotten about CBD, both from my own research, from Dr. Rita's teachings, from the constant education that we have, I've just been overwhelmed. I heard Dr. Betty say that she's just blown away by all of the different things that CBD can do in our bodies. And the truth is, it actually works. Yes. And I reach for my CBD more often than I do my pain medications. I reach for my CBD as opposed to, well, not even as opposed to, I reach for my CBD when anxiety is coming up, when I'm feeling just like I need to quiet the noise. I'm reaching for my CBD first because I understand how it works in my endocannabinoid system. And I understand that this is a science that we were not taught, but a science that truly works. So, you know, I would just encourage anyone that's on the line, whether you're healthcare professionals, whether you are businessmen and women, whether you have family members that have ailments, to just do your due diligence and do your research, because that's where it all starts. We can all be afraid of things. We can all have issues with things because we don't know, and we perish from lack of knowledge. So I really think that it's important for us to understand our bodies, understand the science behind CBD, understand the science behind the endocannabinoid system, and use it to our advantage. Because there's tons of peer-reviewed articles, tons of studies, tons of just information out here about how we can impact change in our bodies in a way that will not cause more detriment than it does help. So I'm sure I didn't hear everything that Dr. Betty said, but I'm sure I can piggyback on what you both have said already, because I know that you all are very confident and competent in your areas of study as well. So thank you for this opportunity to talk to you all.
And thank you, thank you. Also, I want to just kind of piggyback on something you said in terms of anxiety. That's kind of my area when you're talking about anxiety and depression. I worked with so many people, especially through this particular pandemic, everything from grief through loss from the pandemic to anxiousness, anxiety, families being sequestered, as it were, or out of the public, having to have the little ones at home and find themselves overwhelmed, or out of work because of the pandemic. There's so much anxiety out there for so many different reasons. And then of course there's depression. And I found that when I'm working with my clients, I talk to them in reference to leveling, or should I say, using more than one particular product. If you, and I use them as well. In the mornings, what I use because I do a lot of speaking and I do a lot of sitting sometimes, just talking and counseling. So I use the Dr. Rita's Rub. I also use the mango cream with it. And I also use the gummies and the 60 milligram gummies. I use those, and I think I use those every day, as a matter of fact. And I find that they keep me on a level playing ground, as it were. I don't have to worry about getting upset. I don't have to worry about feeling overwhelmed. I don't have to feel like the stress is upon me because I have deadlines that I need to make, or if someone comes in at the last minute or and demands something from me, and it seems like you don't have enough hours in the day to be able to meet all these competing demands that you have. And if I have a backache, or if my knees are aching or whatever, I carry my Extreme with me. And I'll just go in the restroom, I'll put some Extreme on my knees or whatever the pain is, and I will use that. So I carry my CBD with me all the time. And I have more than just one. You can't, one thing I would stress more than anything else is not just one product is going to do it for every situation. You may need those 3 drops under the tongue of one of the tinctures, or you may need the mango lotion or the cream, or the Dr. Rita's Rub, or maybe even the regulars. As I said, I use the 60 milligram gummies. Some people use the Delta 28s, and others feel comfortable with the Delta 8s. But being able to understand that it's okay to level up sometimes, that's what I call it, when you have to use, or when you need to use more than one. And Dr. Betty, I see you just kind of co-signing there, so I'm going to go ahead and get your input on that. Unmute yourself, Dr. Betty.
I totally agree with you in terms of layering. That's what
Yes.
layering.
Layering.
Because I do it too. I take the 500 milligram hempranium. I also use the hemp powered hair.
Yes.
As we age, many times we have thinning of our hair. And I looked at my hair one day and I'm like, hold up, wait a minute. When did that part get to be that wide? And so I immediately started really working to get a regular regimen together to put empowered hair in my, because prior to that I was just kind of hit or miss. Oh, I'm product of the product, I'm gonna take some of this, some of that, you know. But I am now concentrating on my scalp, putting it in topically as well as taking it internally as a tincture under my tongue. And also, you mentioned the extreme relief. Now, I also use that for headaches. If you ever have a headache, wherever it is, you can just take a small amount of that cream. And for instance, a temporal headache or frontal headache or the back of your neck, and just rub it in. And within, oh my goodness, within 5 to 10 minutes,
Exactly.
you will be amazed that you don't even have the headache anymore. Let me just say that we also have products that span some of the most used products. So not only do we have hair products, our Save Our Strands program, which consists of shampoo, leave-in conditioner, conditioner and detangler, and as well as a styling gel. And those products are just really phenomenal.
Yes.
And we also have some skincare. We have our Holy Glow serum, which I must say I really, really enjoy. I have on several occasions as of late been sitting or standing talking to someone, and they say, oh, your skin is just so beautiful. You know, you see yourself every day, so you don't really notice. But yeah, I was quite happy to hear that. So I know a lot of us are approaching or have gone over the hill already. And, you know, it's really now time to start thinking about the whole anti-aging topic, and to really start to utilize products that are going to save our skin, not just our strands.
That's right.
So I would encourage you to check out our anti-aging Holy Glow serum.
Very much so. And I would just say I'm a product of the skincare products as well. And also the Glow Naked. Absolutely. The Glow Naked. And that Glow Naked is wonderful. If you have an ashy skin, or if you have a dry skin, we call it ashy, but you get out of the shower and your skin's a little dry, put that Glow Naked on, and oh my, don't put it on at bedtime. Get out of the shower and dry yourself off and put the Glow Naked on and go to bed, and you just wake up with the most wonderful fragrance. That oud oil is wonderful.
Yes.
And I use that Holy Glow along with that, but I don't know how many people know that you can put the Glow Naked on your hair.
Yes.
So I use that as my hair oil along with a shea butter that we have. But I'll tell you, it has done wonders. I use the hemp powered hair as well, and the every other day, the 3 drops under my tongue. And I also mix the hemp powered hair drops in with my Glow Naked oil and put on my hair. And I found that to be wonderful. It really works well. And as far as the serum, the Holy, what is it, Holy Glow?
Holy Glow.
I love it every night and in the morning. And I'm not afraid to say, because people, when I tell them I'm almost 70, people do not believe it.
Exactly.
Because you take the Holy Glow and just do the neck and the décolletage, as they call it, and upward motions on your skin and your forehead, whatever, every night and every morning. It works. It just feels wonderful.
It does.
And it works so well. So the skincare products are absolutely wonderful. and we're talking about products. So I think, Dr. Betty, we would be remiss if we didn't talk about the bitters. And if we didn't talk about, the
flat belly brew.
Oh man, that flat belly coffee.
Right.
I'm a person that I can't do caffeine normally, but with these green gourmet coffee beans, and I think it's the Cambrosia,
Right.
that's in there. Oh my goodness, I don't have the normal effect that regular caffeine bean gives me, but with this one, I can drink and not have a problem with it. And the bitters, I'm gonna let you take it, Dr. Betty, and talk about that bitters tea. And
I love my bitters. I do them straight, no chaser. So the carb curbing bitters is such a tongue twister.
Okay.
Consists of, you know what, let me just grab one.
Come on.
Consists of herbs,
yes,
that provide a detoxification for our bodies.
Yes.
Now, listen, we talked about the echo pollution that we're breathing in constantly. You've got your food, even if you're trying to eat properly, when you think about all the pesticides, the herbicides, and those kinds of things that are sprayed on the food that we eat constantly, not to mention, depending on where you are in terms of your diet. Many people are still eating lots of fried foods, fast foods, processed foods. Things are going so fast. Sometimes we just don't have time, to have a home cooked meal. So, you grab this at the store and gobble it down. So we have, not to mention, I'm sorry, with the our whole pandemic episode, this has been such a toxic experience that everyone, whether they are cognizant or aware of it or not, has been negatively affected by this whole episode. That's all I can call it. With the fear, the constant talk about death, and the isolation, and that whole thing has really taken a toll on our psyche and our emotions. And so even our mental state, our emotions can cause toxicity in the body, because it can cause our cortisol levels to rise, which increases the inflammation within our body. And inflammation is really kind of the crux of most diseases and conditions.
Exactly. Yes.
And so with that inflammation comes a whole host of toxins that are laid down in our bodies, in addition to those that we intake through our food and drink, and the air that we breathe. So yes, the carb carbing bitters. Yes, I love them. So let me see here. We've got our Cascara sagrada, which helps with stimulating the elimination from the colon. It also draws toxins out of the body. We have our that's another tongue twister, feverfew herb. We've got cilantro. We've got dandelion root, which is an excellent detoxifier. As you know, the little yellow flowers that grow in your yard, when it's overgrown, well, the leaves from there that is the dandelion plant. And they tell you, if you don't pull it up by the root, it'll keep popping up. Well, that root is highly detoxifying, and that root is actually one of the ingredients. Also, senna leaf is a stimulant for elimination of waste and toxins. And then wormwood, last but not least, wormwood is excellent in terms of helping with detoxifying, eliminating parasites from our body. Yes, believe it or not, we all have parasites. You want to call them worms or whatever you want to call them, but we do have them from the food that we eat, etc. I'm telling you, I was in Whole Foods one day at the seafood counter, and I was looking to buy some salmon. And I'm standing there and I'm looking at the nice big piece of salmon, and I saw something move. And I'm like, what was that? And I just kept watching, and it was a worm.
Mm.
So let me tell you, many times we don't see them, but they are there. And that is why it's not good to eat undercooked meat and fish, etc., because parasites do exist. And so our carb curbing bitters also help to curb the that languishing desire for sweet things. You know, we have an addiction to sugar and carbohydrates, and so this tea actually helps us to detoxify from that overabundance of carbohydrates, which causes fat deposition.
Oh,
And
Dr. Betty, also, if you could, can you answer, one of our people in the chat has put this in twice in terms of how many drops makes 15 milligrams of water soluble in a 16-ounce glass. Can you go ahead and address that as well?
okay, so the water soluble CBD is a power product, is 500 milligrams per bottle. That puts us at there 300 drops roughly in that 15 milliliter bottle. And so that puts us at roughly 1.67 milligrams per drop. So if you used 9 to 10 drops, you would have 15 milligrams. And I think she mentioned putting that in a 16-ounce bottle. Yeah, a bottle of water or beverage. Yep, so that is how you do that.
And also, I wanted to add that when you're doing the bitters, one of my clients taught me, one of my partners taught me to get the, you know, I call it the 8-ounce bottles of water that you buy in the store.
Yes.
You could actually take 4 of those, put them in your pot when you're boiling your 32 ounces of that bitters, because it comes in a 32-ounce sack. So you boil that, and of course you have to allow for steam. So you add to it just a little bit after it's done boiling, and then put them into the 4 bottles, because you do the bitters over a 4-day period.
Sure.
So if you pour them back in those 8-ounce bottles, you're taking 8 ounces a day, because you take, if I'm not mistaken, don't you do, some people do it 8 ounces all at one time. Is that correct, Dr. Betty?
They
And so
do.
so that's 4 days, but you already have it made up, because you pour it back into those 8-ounce bottles and put them in the refrigerator, and they're already made.
Yes.
So I thought that was a real sharp way to do that.
Let me just remind you that plastic should preferably be BPA free, so that you're not adding another toxin to it.
That's exactly.
I generally make mine up and put it in a big mason jar.
Very
and
good.
I store it in there. And that way I can, and don't worry if you don't have a 32-ounce container. Maybe you've got 2 24s, or maybe you've got a 64.
However you do it, yeah.
Yeah, you can do it any kind of way, and mix it up in any form that way.
That's
and
right.
Use, you mentioned 8 ounces once a day, or 4 ounces twice a day.
That's right.
And some people even do a little lemon before and after to calm,
Offset.
calm the taste of the bitter.
Hey, because when she said straight up no chaser, that lets you know these bitters are bitter. And in terms of the detox, yes, you're going to have, I've heard different people say that such a smooth move that you can go to work after taking it. Some people do it over the weekend and kind of they're at home because they don't know how that's going to do with the bowel movement. But that's how we're cleaning the bowels. That's how we're doing that detox. So it is a smoother move than you would expect. It's not going to be something that's just so drastic that you can't leave the house. I see someone's, Eppinger said that she chases hers with the flat belly coffee. There you go. So I've heard I've heard different ways that people take the bitters and different ways that people even do the flat belly coffee. Some take it hot, some do it cold, some put it in a shake. I've seen that. And it works. It just really works. I heard somebody say that that first week, it's not uncommon to get rid of or shed 5 to 7 pounds. And so that lets you know how much of that is fecal matter that is just stored along that colon, along your colon wall. You'd be surprised. And Dr. Betty talked about those parasites, and they actually can cause a lot of damage in the colon, and they can contribute to leaky gut syndrome. Also, once you clean yourself out like that, and it's wonderful, once you do it, you even think clearer. A lot of people don't realize that the gut is really connected to the brain. And that's right. When your gut is clean, your brain is clean. You can think clearer.
Yes. The brain fog is eliminated. Yes.
Yeah.
Become a little more creative. I think one thing that people don't recognize too, some people say, oh, I don't need that. I have good bowel movements every day. But did you know that you have over 12 feet of intestine and they're all wrapped up in there? Right. So when was the last time you pooped 12 feet?
That's right.
So that shows you that we have an excess of waste material, and it's important to get it moving, get it out, so that as we're bringing in these fresh new nutrients from the lifestyle that we are actually changing over to, then we can get the maximum benefit of those nutrients.
Right. Dr. Betty, oh, I'm sorry. I was just going to say too, someone wanted you to talk about the lube as well. So lube? There's a request that Dr. Betty, please talk about the lube.
Really?
That's what I see here.
Okay. All right. So the CBD lube. Well, okay, so now I'm going to speak to it from the standpoint of, the baby boomers and women who are approaching and or have moved into and past menopause. And we're all adults on here. So we have, some vaginal drying. Yes. And so the lube is an excellent complement to, especially for sexual health, because it actually lubricates the canal and makes sexual pleasure more pleasurable. It also has, I guess, called a little tingling effect, and also I would say stimulates the genital areas for the male and the female.
That's good. That's good.
Is that enough?
It is. It is.
Is that enough?
I have one more question, and I think it takes you back to where you were. I'm trying to get all this in because I'm looking. We've got about 5 minutes left, but I wanted to quickly talk about one person says, how soon after should we do the next 8 cups? We've done that first 8 cups, but I think it's once a week for the different, because you've got a 8-week supply. When you get the challenge, you've got the 8-week supply. So you've done your first 8 cups, and that's 4 days. So that's for that week. And then, I'm sorry, 32, your first bag of bitters, that's gonna be for your first week. Or do you wanna address that? Or is it 4 days? That's right, 4 days, and that's your first week. So the question is, when's the next 8?
The next bitters, the next detox. Okay,
Yes.
so we really don't need to detox every week.
Okay.
So it would be actually more towards the end of the 8 weeks. The 8 weeks. I mean, depending on how much and how many toxins you actually have in your system. But we don't want to, I guess I could say, strip the body of its natural.
That's right. You need to have those in there. Yeah.
Biotics. We want to support the body, so we cleanse the body. We change our lifestyle. With the challenge, we have a shopping list. We have do's and don'ts of foods that you can and cannot eat. We have meal planning, recipes, and what else? Okay, so we have all of those things to help everyone to move into a different lifestyle in terms of the things that we actually put into our bodies, so that we don't repeat the same mistakes, causing the toxicity in our body and the accumulation of waste, which adds to weight. We're trying to eliminate that. So we do the bitters the first 4 days, and then continue with the coffee. And then somewhere in the 2nd or 3rd month, seeing how you're feeling as an individual, you can do it again. But certainly not every week.
Not every week, because that's right. Because you only have 2 packs of bitters in that one packet. So, and if it's an 8-week supply, then that tells you that your next 8 cups is going to have to come that next month, because you've got 4 weeks, you've got the first 4 weeks, and you've got the second 4 weeks. Am I correct?
Yes, that's pretty much it.
Yes.
But most people will probably want to do it closer to the end, because again, this is a lifestyle change. And so generally speaking, people detox. It's recommended that you detox at the beginning of a season. So, the seasons, we've got 4 seasons, so that's 3-month period. So, closer to the end of that 3-month.
2 months.
It's actually 3 months, because we've got the 2 bitters, but we've got the 3 months worth of
coffee.
Flat belly fruit. Yes.
And so that flat belly, one cup is, one container is gonna be a month. I've noticed that. Yeah. I've noticed that for sure. Well, I'm certainly brand new, and I just started my challenge. So I thank you, because you're also helping me. I've done my bitters, and I love my flat belly coffee. So I'm excited.
And you know what? It's not even a matter of being overweight. We all have toxins. I have virtually no weight to lose, but I have waste to lose.
Okay.
So I encourage everybody to get back with the person that invited you, because obviously they care about you. They want you to know
Yes.
all there is, or as much as you can garner from, about CBD and the products that Wakanna has, which are phenomenal.
Yes.
And so please get back with them. And if you have further questions, please share them with your sponsor, and they can certainly get those questions to myself, to Dr. Sylvester, to Dr. Rita, or Dr. Joy, and we will answer your questions.
For sure.
Yes.
And there's another question. We can't get them all in. As a matter of fact, we're out of time, but someone asked about the immunity, and it is wonderful. I can speak to that immunity. Go ahead, Dr. Betty, but I can speak to that. That is some good stuff. It works.
It is. It really does. It really does. And again, let me go back to the pandemic
Yes.
experience. Okay, so we're going to be opening up the city, what is it, Friday? Some people have been vaccinated, some have not. The virus is still there.
It's still there. That's right.
All the viruses, the flu viruses, all of that is still there. And again, the difference, the determining factor as to whether or not you succumb to any of this is where your immune system is, how well it is functioning. And our immune defense T is an excellent way to boost your immune system, because we're going to need it.
Yes.
You have to, all of the things that you were encouraged to do while the pandemic was going on, while we were on lockdown, please continue your vitamin D, your vitamin C, your zinc, and
Vitamin
these kind
A.
of things.
Don't
Yeah,
forget A.
sure. Your vitamin A, and keeping your system cleansed from the toxins, letting it not be overwhelmed, so that it can function the way that it is supposed to function, and then adding to it the immune defense, as well as black seed oil. Let us not forget about our essential oils, because that black seed oil will knock the wind out of a virus, bacteria. It also is anti-inflammatory, so it assists in helping to relieve the pain.
That's right.
That we have due to inflammation. It helps with balancing your blood sugar, encouraging production of insulin by the beta cells of the pancreas. Just so many functions and benefits that we have here with these excellent organic premium products that we have. So please join us again. We do this every Wednesday. Hopefully Dr. Rita will be back with us next Wednesday. And we send our prayers and healing energy out to her son.
Yes.
Get with the person that brought you onto this call and get the rest of your questions answered.
Yes, and don't forget, black seed oil is also good on your hair.
It is. Oh, it sure is. Yes, it is.
I use it every day.
In fact, and it's in the hemp powered hair too.
Okay. Yes. Okay. Good night, everyone. And we were so glad to be a part of this, and get with the person, as Dr. Betty said, that brought you here, and they can answer any other questions for you, or they certainly can get with either of us on our team, and we'll be more than happy to answer any questions for you. And with that, we say good night. Thank you.
Good night.